Ramsay syndrome is also called herpes zoster oticus. Here oticus means affecting the ears. It is a rare peripheral facial neuropathy. Besides facial paralysis, Ramsay syndrome can also cause painful shingles, rash, and hearing loss in the affected ear. This is the same virus that causes chickenpox, which might be activated by any time soon, causing this dreadful condition. Sometimes there can be involvement of other cranial nerves too. This is due to the blood vessels that shares the common ganglion body. So who can get Ramsay syndrome? It is mainly due to the reactivation of the previous latent virus present in the ganglion. The approximate incidence is about 5 per 100,000. It is seen more common in females than in males. Talking about the age, it is mainly seen in adults, particularly in those people who are over 60 years of age. It is rarely seen in children. About 12% of the facial nerve paralysis is due to Ramsay syndrome. And it is also the second most common cause of non-traumatic peripheral facial paralysis. So let's talk about what causes Ramsay syndrome. After a person is infected with the virus, that is varicella zoster virus, there is a latent period where the virus remains dormant in the neurons of the cranial nerves. It mainly resides in the dorsal root ganglion or autonomic ganglion. The reactivation of this virus in the geniculate ganglion of cranial nerve 7 leads to the condition. The virus can also spread down the axon of other cranial nerves that share the common blood supply with same ganglion. Reactivation needs some fertile conditions. This condition can be person who are immunodeficient, which may be due to HIV or any malignancy. The person might be taking immunosuppressive medication like steroids, chemotherapy, or radiation therapy. The virus can also reactivate if the person experiences infections or physical or emotional stress. So what are the clinical features of this condition? As I already told you, the main features are unilateral facial nerve palsy and painful rash over the affected ear. The rash can be also present in the oropharynx or palate. In about 20%, facial palsy occurs several days before the blisters appear, while in 10%, there can be no blisters at all. Other non-specific symptoms can be flu-like symptoms, which includes fever, headache, before the appearance of rash. Aching and painful sensation in the ear can be felt. Macules, which turns into papules, and then collapsing vesicles at the painful sites are seen, which then rupture, producing crust. There can be loss of taste in the anterior two-thirds of the tongue. Dry eyes and dry mouth can be seen. Tinnitus, hearing loss, hyperacusis, vertigo, nausea and vomiting are experienced. Now, how to diagnose it? Well, diagnosis is mainly done clinically and is considered by testing with a PCR for the virus. The ear exudate can be taken as a sample for PCR. It is necessary to distinguish it from Bell's palsy as the treatment varies. Now let's talk about the treatment. If antiviral is started within 72 hours of onset of symptoms, there can be a chance of full recovery. But the recovery chance decreases as the time passes. The treatment includes acyclovir, valcyclovir, famciclovir, and combination of antiviral treatments with prednisolone, that is corticosteroids. Other treatments can include the symptomatic approach, which includes corticosteroids, opioid analgesics, anticonvulsants such as gabapentin or pregabalin, ice packs on the blisters. Eye patch can be given if the patient is unable to close the eyes. Artificial tear and lubrication can be a help to reduce dry eye symptoms. Transcutaneous electrical nerve stimulation and vibrations can also be given. The prognosis is poorer than that of Bell's palsy, and completely recovery is less likely if antivirals are started beyond 72 hours. Poor prognosis factors include diabetes mellitus, advanced age, that is age greater than 60, hypertension, vertigo. It can bring many complications to the patient. The complication can include permanent facial paralysis, hearing loss, synkinesis, which means unwanted facial movements linked to deliberate movement, polycranial neuropathy, myelitis, that means inflammation of the spinal cord, and post-herpetic neuralgia. That's all for today. Thank you.
You